Welcome to today's eESI podcast. Our subject, telemedicine, one of the most important trends in healthcare. And our special guest, Jenifer Allbright. Jenifer is the Director of Benefit Services at eESI. And welcome, Jenifer, to our program today.
Thank you.
Well, let's talk about telemedicine. This is a growth industry. Over $20 billion industry this year, 2,100% growth since 2013, and more than half of all U.S. hospitals currently have a telemedicine program, meaning their doctors are now available to people when they call in through a telehealth service. What else can you tell us about this trend in telemedicine?
Well, there's a very interesting statistic that I was looking at today. There has been about 800,000 online consultations in the U.S. using telemedicine in just 2015. So it has dramatically grown since then. The average cost per visit to go to the doctor ranges around $125. The average cost of a telehealth visit with other companies, with your major carriers and such, runs anywhere from $25 to $45.
But how's the quality of care? Is it comparable to what you'd get by visiting a doctor?
Absolutely. The study of the outcomes of over 8,000 patients showed there was no difference in quality of care between an in-person visit and a telehealth visit. And about 67% of the patients said that using telemedicine somewhat or significantly increases their satisfaction with medical care. So they're getting care that they may not have received if they were not on the telemedicine program.
What percentage of doctors' visits could be handled by telemedicine?
According to research, almost 75% of all doctors' visits, urgent cares, and ER visits could be handled safely and effectively by telemedicine.
That's incredible. So 75% of all the health issues that someone might go visit a doctor or go to urgent care or go to the emergency room for could be handled by telemedicine. And there's virtually no difference in the quality of care. It sounds like this is something that's going to really have a very significant impact on the industry.
It is, and it has, Lou. This is a huge program that everybody is loving to be a part of, and it's cutting down costs for them.
Well, eESI has their own telemedicine program called Teladoc. Tell us about Teladoc, and how is Teladoc different than most other forms of telemedicine?
What is different about our program is where the other carriers may have a telemedicine program, but the visits are around $45 to call in and talk to a doctor. We have a $0 copay, so it costs them absolutely nothing to call in and talk to a licensed physician over the phone.
And who does it cover?
That is another great point. It covers everyone in the household, whether they have family coverage for their medical or individual coverage for their medical. It will cover anybody in the household can use the telemedicine program to get prescriptions.
So even if you're not covered by the company, if you are related to someone who is covered by the company, your telehealth visit, your Teladoc visit will be covered also. Is that what you're saying?
Absolutely, which is a wonderful benefit.
Is that access all the time, or are there certain hours of the day?
This is a 24-hour, 7-day-a-week access. And I've heard customers say that they were traveling out of town, forgot their medication, and had to call in. Or they got sick while they were on vacation. Of course, you don't have a doctor in that area where you could call in for you or your family member and get treated right there wherever you are.
What can a doctor do with Teladoc? Can they prescribe medications over the phone? How available is it?
It is a huge program that nationwide, whether you're traveling out of town or it's the middle of the night or it's the weekend, you're able to call in, talk to the doctor over the phone, describe what's going on. They can look at your medical history, and they're able to prescribe you medications over the phone that you can go down and pick up at your local pharmacy. They can prescribe anything from antibiotics, steroids, whatever it is that you're needing in most cases. It keeps you from having to go to the doctor, take time off work, and miss work if your children are sick. So overall, it is a great program that saves money, gives people access to care that they may not have utilized before, and it controls the cost of the insurance plan because it takes some of the usage off of it.
Sounds like a very important trend. I can see why it's growing rapidly. Thank you, Jenifer, for helping us understand more about telemedicine and for telling us about the eESI's version called Teladoc, which sounds unique and certainly better than most telemedicine services that are available through health insurance plans.
You're so welcome. Thank you so much.
Have a great day. If you are looking to improve your healthcare coverage and want to access telemedicine, contact eESI at 210-495-1171. That's 210-495-1171. And ask to speak to an HR business partner or ask to speak to Jenifer Allbright herself. eESI's TeleDoc brand of telemedicine enables everyone in your employee's household to utilize the service, even if they are not the insured. And it is free, no copays. 75% of the time, as you heard, it'll handle the issue that you might be inquiring about. If you are sick, most of the time TeleDoc may be all you need. What a tremendous service. So make sure to contact eESI to learn more. Thanks for listening to today's podcast, part of our goal to help you simplify business.